Welcome to HMSA's Quest Integration Provider Training. Thank you for taking the time to attend this overview of our program. Prior to today's webinar, we emailed you a copy of today's slides, an attestation form, and an evaluation form, along with the link to the webinar. We ask that you take a moment at the completion of today's session to fill in both of these forms and email or fax them back to us. We have recorded the information that we're providing today, and it is available in the Provider Resource Center for future reference, along with a copy of the attestation form and a PDF file of the PowerPoint slides. HMSA's Quest Integration Plan is different from our private business plans in many ways, so there's a lot of information we're going to be covering today. The topics we'll be covering include our online and electronic services, verifying member eligibility, the PCP's roles and responsibilities as they pertain to the Quest Integration Plan, provider grievances and appeals, land framework and the value-based program model, processes for referrals and prior authorizations, accessing HMSA's pharmacy and drug formulary, information on filing your Quest Integration claims, and the EPSDT program. We'll talk about the programs that support members and providers, our members' rights and responsibilities, as well as the member grievance and appeal process. We'll also go over cultural competency and some additional resources for our providers. Because we have so much information to cover, I'd like to ask that if you have any questions, please type them in the chat box and we'll do our best to answer your questions at the end of the presentation. We've had several Quest Integration Plan trainings in June and July, and we'll also have another Quest Integration webinar in November this year. Thereafter, we'll have trainings each year in March, July, and November. Before we get started, I'd like to go over some icons you'll be seeing throughout today's presentation. The first is the RSS icon, and you'll see this anytime we're referencing an internet address. Then we have a telephone for phone numbers, fax machine for fax numbers. Anytime you see a mailbox is for a mailing address. And lastly, the envelope with the @ symbol. And you'll see this whenever we have an email address for you. Quest Integration members will belong to one of three groups: non-ABD, which is comprised of members who are not aged, blind, or disabled. The ABD group includes members who are age blind or have disabilities. And the third group is the ABD and LTSS, or long-term services and supports. Members in this group have additional benefits to support their needs. For our first topic today, we'll be covering HMSA's Hawaii Healthcare Information Network, or as we commonly refer to it as HIN or HHIN. And we'll also cover electronic transaction services. Hawaii Healthcare Information Network is a free, secure HMSA website that participating providers may use to access members' plans, benefits, and claims information. Because it provides access to protected health information, we do require users to register, and logging in requires a username and password. Once you've logged in, this is the first page you'll see. The HIN homepage displays the most current announcements at the top of the page, and the menu on the left-hand side features function links to help you navigate through HIN. There are also tabs along the top of the page that are external links to other resource centers. Using the function links on the left-hand side, you can access Quest Integration members' eligibility information, plan benefits, check on claim status, view and submit referrals, enter pre-authorization requests, submit travel requests, and view fee schedules. One of the features of HIN is the Vision Accumulator, which is specific to the Quest Integration Vision benefits. This applies to all of the Quest Integration members except for those who have an FQHC as their PCP or service provider. The Vision Benefit Accumulator will show you the date of the member's last vision exam, as well as the date the most recent appliance was dispensed to the member. If you're not already registered to use HIN or you have new staff in your office, you can contact us at 948-6255 for new user access. Each HIN user in your office should have their own login ID and should not be sharing login IDs among staff. If you need technical support with HIN, please contact our HIN help desk by using the phone number or email provided here. HMSA offers several electronic transaction options that are EDI compliant. EDI is an electronic communication method that provides standard formats for sending electronic claims, receiving remittance information, and getting eligibility and claim status. HMSA supports EDI transactions for eligibility verification, electronic claim submission, claim status, electronic funds transfer, electronic remittance advice, and reports to provider for our commercial and Medicare lines of business. Providers have two options for submitting electronic claims to HMSA. The first option is bulk processing, where multiple claims are sent in a file. This method requires an electronic billing system or the use of a clearinghouse. The second option is HMSA's free e-claim system. Providers may submit electronic claims for all of HMSA's lines of business over a secure internet connection. Providers may also void or correct claims that were previously submitted. Some of the benefits of submitting claims via e-claims include less paper usage, cost and time savings as processing of electronic claims has a quicker turnaround over paper claims. You'll also have reduced delays caused by common data entry errors and fewer rejected claims. This will help you have an improved and more stable cash flow. Both participating and non-participating providers may use the e-claim system. All that's needed is internet access, a web browser using Internet Explorer version 7 or higher, an NPI number, and HIN access. If you would like more information on HMSA's e-claims, or if you'd like to request for a new setup or training on e-claims, please contact our ETS outreach at the number shown here or via email at etsoutreach@hmsa.com. If you need technical support for any EDI issue, our EDI help desk can assist you via phone or email. And for HIN assistance, you may call us or email using the contact information shown here. Our next topic is verifying member eligibility. Because member eligibility is not guaranteed for each month, we encourage providers to check membership ID cards at each visit. Eligibility may be verified using HIN, which is available 24 hours, 7 days a week, or during business hours of 7:45 to 4:30. Providers may call the Quest Integration Provider Service line using the numbers shown here. You may also confirm members' eligibility by checking his or her current Quest Integration membership card. The card provides you with several pieces of essential information, including the Quest Integration member number, the name of the PCP and the effective date the member was assigned to that PCP, the type of coverage they have, and if they have any other insurance that's in our system, that will be shown in the TPL area in the bottom right-hand corner. The benefit field on the membership card indicates the category of coverage the member has. So remember, they'll fall into one of three categories. They'll be non-ABD, ABD, or ABD and LTSS. The backside of the Quest Integration Member ID card has important information for both members and providers, such as the phone numbers to our 24-hour call center and nurse line, as well as where to submit your Quest integration claims. In this next section, we'll be talking about the responsibilities of the primary care provider. As a participating provider, there are certain conditions you are required to meet. It is a requirement that providers comply with ADA and non-discriminatory requirements and continue to meet visit accessibility standards for appointments, as well as continue to meet all ADA requirements. All records must be kept confidential and maintained according to standard medical practice. Providers must adhere to standards of care and discuss treatment options with patients. Accessibility standards must be followed for patient appointments, and as a member's PCP, the provider will serve as the primary source of medical care for their assigned patients. As a Quest integration member, as their PCP, the provider will coordinate referrals for specialty care. They need to maintain continuity of care and maintain patient health records. PCPs must also have hospital admitting privileges. If you don't have hospital admitting privileges, you must have a written agreement with a provider who does. EPSDT exams must be provided to age-appropriate patients, and providers will work with the health coordinator to coordinate patient care and to develop a service plan for members with special health care needs. We ask that providers inform HMSA of cases that have the potential to require health coordination services, primarily those which would be high cost, high utilization, complex, or special health care needs cases. PCPs are encouraged to attend or be represented at informational sessions concerning their patient's care. If your patient has requested to change PCPs, we ask that you continue to provide services to that patient until the transition has been completed. Providers are required to report all cases of suspected child abuse to the Department of Human Services Child Welfare Services section, and to report all suspected dependent adult abuse to the DHS Adult Protection Services section. Claims shall be submitted for all patient encounters to document services rendered. All services billed must be supported by documentation in the patient's medical record. Any suspected fraud or abuse, and whether that's by members or other providers, must be reported to HMSA. Medical records must be maintained for a minimum of at least 10 years from the last entry in the records. For minors, records must be maintained while they're minors, plus a minimum of 10 years after the age of majority. Please note that this is an update. The previous requirement was to maintain the patient's records for the additional 7 years. During the period of record retention, the state and federal governments must be allowed full access to the records to the extent allowed by law. In the event of a change in PCP being requested, records should be transferred to the new PCP within 7 business days from the receipt of the records request. All medical records must be legible, signed, and dated. The records must accurately document all services provided and billed for. These records must be made available to the Department of Human Services, HMSA, and others as specified by the Department of Human Services for audit and review purposes. Quest integration members have the right to request and receive copies of their medical records, as well as the right to request that their medical records be amended or corrected. When it comes to member billing, there are certain circumstances when a Quest integration member can be billed and circumstances when they cannot be billed. Providers agree to accept Quest Integration Plan payments as payment in full and may not balance bill Quest Integration members. Anytime a Quest Integration member misses an appointment, you cannot charge a no-show fee to that patient. If the Quest Integration member is requesting a non-covered or upgraded service, the member must sign an Agreement of Financial Responsibility form prior to having the service rendered. Another example of when a member can be billed is if a service is provided before or after their period of eligibility. Primary insurance payments that are sent to the member or plan subscriber may be collected. In a situation where a Quest Integration member is responsible for paying a portion of their monthly health care, those cost shares may be collected from a Quest Integration member. When MedQuest deems a member liable for a cost-sharing portion, the member will pay that cost share to either a provider or to HMSA. This will generally apply to the Quest Integration members who are at a nursing facility or with a home and community-based provider, or a non-institutionalized member receiving LTSS services. Amounts collected will be reported on a CMS 1500 claim form in field 29 or on a UBO 4 claim form in field locator 39 with value code 23. If the cost share collected is greater than the claim charges, the provider will be invoiced for the amount that is not covered by the claim. Providers shall also comply with ADA responsibilities by providing needed medical and behavioral health services regardless of race, color, sex, national origin, religion, creed, age, marital status, sexual preference, or mental or physical challenges. Compliance with the provisions of the Americans with Disabilities Act, including providing sign language interpretation services, is required. Provider offices with special language and communication skills are asked to inform HMSA of these abilities to facilitate member assignment to providers who are best able to communicate with them in their preferred language. To be a part of HMSA's provider network, all providers must warrant at the onset and for the duration of their contract that the provider and any affiliated providers, including owners, agents, or managing employees, are not excluded from participating in federal or state health programs. If they are found to be excluded, HMSA is required to immediately terminate the provider or affiliated providers from our provider network. Providers must search excluded provider lists regularly and confirm that employees and contractors are not on these lists. Providers should also check the list prior to hiring staff to ensure that they are not on any excluded provider list. There are 2 federal sites and 2 state sites that must be checked. These sites list individuals and entities who are excluded from government contracting and healthcare programs. While searching multiple lists is inconvenient, the lists are maintained for different reasons. So here on this slide, we have the web addresses for the 2 federal lists. These would apply to Quest Integration and Medicare Advantage plans. The 2 state sites are applicable to the Quest Integration plan only. So if you're participating with both Medicare and Medicaid, you will need to check all 4 lists. Okay, now we're going to spend a couple minutes reviewing the process for provider grievances and appeals. If a provider is dissatisfied with our operations, activities, or behaviors, they may initiate the grievance process. The grievance needs to be submitted in writing to the grievance coordinator within 60 days of the payment or episode. Be sure to include the provider's name, address, telephone number, and their HMSA provider ID number. You'll also need to include a description of the grievance, including, if needed, the member's name and ID number, along with any supporting documentation. HMSA will have a resolution to the grievance within 60 days of receiving it. Providers then have further recourse through the appeal process. Providers may file an appeal if service requested was denied or restricted. Free service denials are considered member appeals, and we'll cover member appeals a little further on in the webinar. An appeal may be filed if an authorization for service was terminated, suspended, or reduced, or if the provider is unhappy with healthcare services that were untimely, were unreasonably delayed, or the grievance or appeal decision was not carried out in a timely manner. When submitting an appeal, providers should submit their request in writing to the grievance coordinator within 30 days of the determination or denial. Appeals should include the provider's name, address, telephone number, and HMSA provider number. When submitting an appeal, be sure to include a description of your appeal, including, if needed, member and ID number, name and ID number, along with any copies of supporting documentation. HMSA will have a resolution within 60 days of receiving the appeal. Providers have further recourse for the appeal through arbitration. So if you need to file an appeal, here we have the link to our pre-certification denial. You can access that form, and we have a sample here on this slide. Providers may submit their grievances and appeals to the Quest Integration Grievance Coordinator. If you're unsure of whether your issue would be considered a grievance or an appeal, you should contact the grievance coordinator and ask for guidance. Providers are required to submit their grievance or appeal in writing, and this can be done either by fax or by mailing it to the address on this slide. For more information, you may use the link shown at the bottom of the slide to read our page in the Provider Resource Center on the Quest Integration Provider Reconsiderations, Grievance, and Appeals process. Here we have some examples of situations where a provider might file a grievance. If you have concerns regarding benefits and limits on behavioral health or the formulary, if you're experiencing member issues such as no-shows or other member-related concerns, if you're having issues with the health plan, such as difficulty making contact, or you're having a lot of claim denials, if there's issues regarding the availability of services, such as delays in obtaining services, medications, or ancillary services, if the provider is unable to make referrals to a specialist, or if medication is not being provided by a pharmacy. Our next topic today is Healthcare Payment Learning and Action Network and the Value-Based Payment Model. HCP LAN, or LAN, is a national collaboration between private, public, and nonprofit healthcare stakeholders. It's convened by the Health and Human Services to provide clinical and policy leadership with the goal of transforming the nation's health system to emphasize value over volume. Health and Human Services launched the Learning and Action Network to advance the adoption of value-based payments and alternative payment models across healthcare sectors. More information on the HCP LAN is available at the hcp-lan.org website. The Alternative Payment Model Framework is the LAN's landmark achievement. It establishes a common vocabulary and pathway for measuring successful payment models. Originally published in 2016 and refreshed in 2017, the framework classifies alternative payment models in 4 categories and 8 subcategories, specifying decision rules to standardize classification efforts. It lays out core principles for designing alternative payment models, which have influenced payers and purchasers, and it also forms the basis of the annual APM measurement effort. Private payers use the framework to set value-based payment goals and at least 12 state Medicaid agencies use it to set value-based purchasing requirements in contracts with managed care organizations. The value-based payment model is an approach to payment reform that links provider reimbursement with improved performance, or that aligns payment with quality and efficiency. The value-based payment model holds healthcare providers accountable for both the cost and quality of care they provide. It strives to reduce inappropriate care and to identify and reward the highest performing providers. The value-based payment model may include, but not be limited to, different reimbursement strategies such as fee-for-service with incentives for performance, capitation payment to providers with assigned responsibility for patient care, or it may be a hybrid model. Let's move on now and talk about referrals and prior authorizations. Throughout this section, we'll talk about prior authorizations or pre-certification. These terms are used interchangeably. Within the Quest integration plan, there are certain services that members can self-refer for. These include behavioral health, family planning, refractive vision services, well woman exams, and mammograms. Care provided by other specialists do require a referral from the member's PCP. However, the provider is not required to submit the referral request to HMSA. We do ask that you ensure to make the appropriate notes in the patient's medical record. Registering referrals may be done one of three ways: by fax, by registering services online using HIN, or by calling the Quest Integration Provider Service Line. If you're faxing your request, there is no need to mail a follow-up confirmation copy. No supplemental reports are needed, and referral forms may be obtained in the Provider Resource Center using the link shown here. Some services require a prior authorization and approval. Approval for these services needs to be obtained prior to rendering service. Some examples of these services are bone density studies, durable medical equipment, hearing aids, plastic surgery services, physical, occupational, and speech therapy, vision eyewear, and referrals to providers who are not part of HMSA's Quest Integration Network. Requests for pre-certification of services after they have been rendered may be considered if the request is submitted within 120 days of the date the service was rendered. Written guidelines and a complete list of services requiring prior authorizations are included in the Quest Provider Handbook. They're also available at the link shown here on your slide. Providers can obtain the utilization management criteria, and hard copies of the criteria are made available to providers upon request by phone, fax, or mail to Quest Integration Provider Services. Some services that require prior authorization are reviewed in-house at HMSA, while other services are managed by some of our partners. Here's a quick overview of our partners, but we'll review each of these more in depth coming up. So to promote the appropriate utilization of advanced diagnostic imaging in cases where traditional imaging would provide sufficient diagnostic information to treat the member, or where another imaging study would be more appropriate based on the patient's condition, HMSA has contracted with National Imaging Associates, Magellan, or NIA Magellan, to provide pre-certification services. We also partner with Evicor to assist in the management of outpatient physical therapy, occupational therapy, and chiropractic services. The objective of these programs is to bring transparency and accountability to the practice patterns, as well as promoting efficiency in the delivery of therapy services. And we also have CVS Caremark, who handles all of our prior authorization drug requests. Beacon Health Options provides utilization management services for behavioral health and substance use for HMSA's Quest integration members. HMSA's Medical Management Department reviews requests for services such as long-term services and supports, post-acute care services, speech therapy, and referrals to out-of-state providers. And our HMSA Quest Integration Provider Service handles requests for travel and lodging, for in-state out-of-network referrals, and replacement eyewear. Okay, next we're going to take a closer look at each of these partners. Here we list some examples of the services that are managed by Magellan. A complete list of services along with their corresponding CPT-4 codes for all of the services managed by Magellan on behalf of HMSA can be found in the Provider Resource Center on the Magellan page. The link here will take you to our Magellan page in the Provider Resource Center. Please note that services rendered in an emergency room, observation room, surgery center, or hospital inpatient setting are not managed by Magellan Healthcare. We encourage you to submit your requests online through radmd.com. After establishing your secure login, you're then able to submit your request anytime, 24 hours, 7 days a week. Clinical information can be uploaded securely via the website rather than faxed. And Magellan also has a toll-free number to request pre-certifications over the phone. For technical support, Magellan can be reached via email or using their toll-free number shown here. Clinically urgent requests are for conditions that require prompt intervention to prevent additional health issues for the patient. Conditions that require urgent intervention include those that cannot be postponed for 24 hours without risking progression to an emergent condition, and those that cannot be postponed for 24 hours without risking loss of life or limb or permanent disability. Providers must submit member information and clinical reasons for the urgent request. Authorization is given at the completion of the contact. Providers must contact NIA by calling the dedicated phone line or by selecting the clinically urgent option if you're using RadMD online. For services that meet the conditions of being considered clinically urgent, these cases are automatically approved. EviCore, our partner in the management of outpatient physical therapy, occupational therapy, and chiropractic services. We have more information on PT, OT, and chiropractic services. You can use our link here to visit the Provider Resource Center page. To request pre-certification of these services, providers will need to register and log in at evicore.com. Forms for PT, OT, and chiropractic services are available at the EviCore website. Once your treatment plan is completed, you may submit your form via evicore.com or via fax. And if you have any questions, please contact EviCore directly at 888-638-7876. CVS is HMSA's partner for pre-certifying drugs. Drugs requiring pre-certification are contained in our drug formularies. Requests for pre-certification of specialty drugs may be submitted to CVS by fax or phone. Pre-authorizations may also be done online using the CVS Novologics tool in HHIN. On behalf of HMSA, Beacon Health Options provides utilization management services for behavioral health and substance use. They manage pre-certifications for methadone LAM treatment, referrals to out-of-state providers, and residential treatment. Beacon's approach deploys utilization managers, case managers, and provider network professionals into the local markets. Working closely together, this approach facilitates better coordination of care for members with physical, behavioral, and social conditions and is designed to support a medical home model. At the bottom of your screen is a link to the prior authorization form for Beacon Health. PCPs may request support from Beacon at 695-7700 or toll-free from the neighbor islands using the number here. Once you've completed the form, PCP referral forms can be faxed to Beacon at 695-799 or mailed to the address at the bottom of your screen. As mentioned previously, Quest Integration Provider Services we manage the in-state, out-of-network referrals, travel and lodging requests, as well as replacement eyewear requests. These may be made by phone or fax to the numbers shown here. For services that require HMSA reviews, our pre-certification forms are available online in the Provider Resource Center. Links to the forms for general requests and post-acute care services are provided here. After completing the forms may be mailed or faxed back to us. We also have a phone number that you may call for assistance. We can also accept prior authorization requests electronically using HIN. iExchange is the online platform that allows submission of pre-certification requests and referral registration. Referrals to out-of-state providers must be approved by HMSA for the service to be covered. Timeliness guidelines for prior authorization requests are 14 days for routine requests, although most requests are completed in a much shorter time frame. Urgent requests are handled within 3 business days. We understand that there may be instances in which a member may be retroactively enrolled into Quest Integration. If services that require pre-certification have already been rendered for a member in this situation, you would go ahead and submit a claim for services with the documentation to support medical necessity. The claim will undergo medical review during the claim processing process. If you're interested in receiving training on submitting pre-certifications electronically, please make a note on your evaluation form that you're going to complete after today's session, and we will contact you to arrange training. If you're registered to use the HIN system, tabs for registering your referrals and requesting pre-authorizations are under the Quest Integration tab on the left-hand side of the screen. Okay, moving on, we're going to take a look at the Quest Integration Pharmacy and Drug Formulary. The formulary for our Quest Integration plans is available in the Provider Resource Center. We update the document periodically, so be sure you are checking for the most current version. Our participating pharmacies have the most up-to-date formulary information at the time prescriptions are filled. You can also reference our pharmacy and drug formulary page in the Provider Resource Center for more information. This very long link you see on your screen will take you directly to the formulary document. However, there is an easier way to get there, so this shorter link at the top of your screen will help you access the formulary document. The link takes you to the Quest Integration Drug Formulary page in the Provider Resource Center. And on that page, you'll see that very long link that was on the previous slide. You could also use the search bar in the Provider Resource Center. Just type in Quest Formulary, and usually the first result that comes up is the link to the formulary page. You can also use the drop-down menu on the top banner of the Provider Resource Center for easy access to the formulary and pharmacy information. Let's talk now a little about filing your Quest Integration claims. There are a number of things that affect the processing of a claim. Some of the things that are checked are, was the patient eligible for benefits on the date of service? Was the service approved? Is the service a planned benefit? And is the claim fully completed, or is there missing information? Professional services are billed on the CMS 1500 claim form, while facility services are billed on a UB04 claim form. Both forms are available from local form vendors. Providers have 1 year from the date of service to file all claims to HMSA. We do ask that you file your claims promptly. The sooner your claim is submitted and processed, the sooner you will receive payment. When the patient has dual coverage, the other insurance is always primary to Quest integration. Submit your electronic or paper remittance advice with your Quest integration claim. Quest integration claims may be submitted to HMSA via paper or electronic submission. If you're submitting a claim for long-term care confinement, be sure that the DHS Level of Care and At-Risk Evaluation Form 1147 has been approved. For paper claim submissions, all claims undergo optical scanning to enter our processing system. So for that reason, we can only accept original red ink claim forms. Claims have to be legible to be processed, so we do ask that you use font size between 10 and 12 with black ink. Please don't exceed a data field size by trying to squeeze in more information than it was designed to hold. Also, do not use highlighters, as our claims scanning equipment cannot read highlighted fields, and do not use whiteout. Claims with missing or invalid information are not accepted into the processing system. A return letter will be sent to the provider detailing claim service dates, the total charge on the claim, and the patient control number. Patient medical records must document all services that are submitted on claims. And we do ask that you use all capital letters to help minimize confusion with similar characters such as ones, I's, and L's. So just a quick recap to minimize your rejected claims. Do not use photocopied CMS 1500 forms, only the original red line forms. Enter only the amount of information the claim field was designed to hold. And please do not use highlighters or whiteout on your claim submissions. Some claims may be returned to the provider before it even enters HMSA's claim processing system. So these will kick out on what we call our front-end edits. And this happens for a variety of reasons. Some of these reasons could be your diagnosis codes or ICD codes are invalid, mismatched member ID names and numbers, or invalid CPT codes. Paper claims are returned to the provider with a rejection letter, while electronically submitted claims are returned in an electronic file named Claims Rejected to Provider. Upon receiving this from HMSA, you will go ahead and make the appropriate corrections and submit it as a new claim for service. Do not label previously rejected claims as a resubmission. There are times when claims will be denied. If the claim enters the processing system and denies, it will be reported on your report to provider, along with a message code explaining why benefits were not allowed. If you're resubmitting this claim with corrections, the claim must be sent in again and labeled as a resubmitted claim. This avoids the claim being denied as a duplicate of a previously processed claim. So when you're resubmitting claims, we have here instructions on how to resubmit a paper claim for professional services to HMSA. Be sure to complete block 22 and enter resubmission code 7. The 7 lets us know that this is a replacement claim. In block 22, you'll also enter your original claim ID number. This is found on your report to provider. In block 19, you'll enter the reason for your correction or any attachments. The information required for resubmitting electronic claims is very similar to paper claims. You'll use claim frequency code 7, enter your original HMSA claim ID number, and reason for resubmission will be entered in loop 2300. The United States Department of Human Services requires certain information on outpatient claims for drugs as permitted by the Affordable Care Act. Information required on the claim includes the National Drug Code, or NDC, of the drug dispensed, the name of the drug, the quantity billed, and the NDC unit qualifier. For example, whether that would be in grams or milliliters. The most specific HCPCS or CPT code for the drug should be billed. Compound drugs that do not include a drug approved by the U.S. Food and Drug Administration may be denied. When billing a specific CPT or HCPCS drug code, the CPT or HCPCS unit should be billed in the HCPCS unit field. When billing an unlisted or not otherwise classified drug code, such as J3490, J3590, or J9999, or any other miscellaneous code, the NDC unit should be billed in both the NDC and HCPCS units fields. For insurance billing purposes, Centers for Medicare and Medicaid Services created an 11-digit NDC derivative identifier. For example, like the one shown on your screen. The CMS NDC identifier has 11 digits with no spaces, hyphens, or other characters. If the NDC package code is less than 11 digits, the code must be padded with leading zeros. The leading zeros must be added to the appropriate segment to create the 542 configuration shown here. So you'll have a 4 or 5 digit manufacturer identification number, a 3 or 4 digit product ID, and a 1 or 2 digit package size and type code. Paper claims may be submitted to HMSA Quest integration using the address shown here. These next two slides are primarily for our long-term service and support providers. We do include it in this session to give all of our providers an overall picture of some of the requirements of the Quest integration plan regarding long-term service and supports. LTSS providers are contracted to provide only the specific services listed here. They should submit claims only for these contracted services. Claims that are received for non-contracted services will be denied. LTSS providers such as community care, foster family homes should not submit any claims for a period when the member is hospitalized or confined in a long-term care facility. Be sure to use appropriate codes and units. For example, if you're billing a code described as per day, you want to ensure you're billing in number of days. Quest integration claims are processed daily, and weekly payments are made on Thursdays. Claims processed by Tuesday are included in Thursday's payments, and checks are accompanied with a report to provider. Arrangements for direct deposits or electronic funds transfers can be made, and we do ask that you promptly reconcile your report to provider with your accounts receivable so that you can monitor any outstanding claims for follow-up as needed. This is a sample of the Quest integration report to provider. Looks very similar to our other lines of business, but it does say Quest integration in the upper right-hand corner. It will include any paid claims, denied claims, and adjustments. The early and periodic screening, diagnostic, and treatment benefit provides comprehensive and preventive healthcare services for children under age 21 who are enrolled in Medicaid. EPSDT is key to ensuring that children and adolescents receive appropriate preventive, dental, mental health, developmental, and specialty services. EPSDT is a federally mandated program. HMSA will cover all medically necessary diagnostic and treatment services or behavioral health problems discovered during an EPSDT screening. This includes timely immunizations and tuberculin screenings, diagnosis and treatment of defects in vision and hearing, diagnosis and treatment of any issues found in general developmental and autism screening, and diagnosis and treatment of acute and chronic medical and behavioral health conditions, as well as medical-related dental services. Providers are critical to the program's success. In order for this program to be successful, it is critical that parents and the child's PCP are involved. HMSA makes every effort to effectively communicate with parents and PCPs. The Quest Integration Health Screening Assessment Schedule and general information regarding EPSDT can be found in the Provider Resource Center using the first link. The second link shown here will take you to a sample of the DHS 8015 exam form. A global fee is paid for each screening examination, billed with a CPT E&M code when billed with modifier EP and a Y indicator in column 24H of your claim. A completed DHS Form 8015 must also be submitted with claims, or visits will be denied with a message advising that an EPSDT form is needed. The global fee includes payment for the mandatory and optional procedures and tests, as well as administration of immunizations. The cost of vaccines for immunizations for children through age 18 years of age is not paid, since these vaccinations are available at no cost from the Department of Health's Vaccines for Children program. If your claim is filed on a CMS 1500 paper claim form, you can go ahead and staple the EPSDT form to your claim form. However, if your EPSDT visit is being billed electronically, please mail the EPSDT form to the Quest integration address shown on this slide. It is important that the EPSDT form is received by HMSA by the time the electronic claim is received. So this means that you should mail your EPSDT form probably about 3 days before you submit your electronic claim form for that visit. Original EPSDT forms are available from ACS. These forms may be ordered by phone, fax, or email using the contact information shown here. Now let's talk about HMSA programs that support both members and providers. Some of the ways HMSA partners with PCPs is by providing health coordination services for challenging patients by focusing on care gaps, working with PCPs and their staff to provide COPD management, information, and plans, collaborating with PCPs to accurately complete patient health risk assessments, and to ensure timely access to patient care, and communicating updates to the interdisciplinary care team. We'll talk more about the interdisciplinary care team in the health coordination services section that's coming up in a little bit. We ask our participating providers to partner with HMSA by focusing on care gaps and closing those gaps in care, collaborating with HMSA's nurses to ensure accurate, timely health risk assessment completion, providing medical records when requested, discussing advanced care planning and pulse with our dual care patients, discussing COPD management information and plans with those patients as needed, and participating as a critical member on the interdisciplinary care team. Our quality improvement program reflects HMSA's commitment to facilitate ongoing improvement in the delivery of high-quality healthcare. The primary activities of the quality improvement program focus on preventive care and disease management. These activities include data analysis and reporting, particularly for programs involving asthma care, diabetes treatment, and screening programs. Member satisfaction surveys such as the annual Consumer Assessment of Health Plans Survey, or commonly known as CAHPS, accessibility standards and timeliness, practitioner credentialing, monitoring member complaints, and utilization monitoring. More information regarding HMSA's quality improvement and payment transformation programs can be found in the Provider Resource Center using the links here. HMSA's Quest Integration Plan Health Coordination Services Program is a person-centered service delivery system to ensure that the needs of members with special healthcare needs, expanded healthcare needs, and those receiving long-term services and supports are met. For members not meeting the requirements for health coordination services, assistance is also available to help providers with these members who face unusual or short-term conditions. For special healthcare needs and expanded healthcare needs members, as well as those receiving long-term service and supports, health coordinators will assist in coordinating Quest integration services with other federal programs such as Medicare, as well as other state departments, agencies, and community services as appropriate for the member. HMSA's Health Coordination Services offers providers and patients extra support with healthcare planning, coordination of services, service implementation, and care evaluation and adjustment. Health coordinators will assist adults and children with special healthcare needs, expanded healthcare needs, and those receiving LTSS services in receiving these extra supports. If you need assistance with a patient that can benefit from or who requires health coordination services, please complete the care navigation form available at the link here, or call HMSA's Health Coordination Services intake line at 948-6997. Or you could call us toll-free from the neighbor islands. These are available weekdays from 7:45 to 4:30. HMSA's Health Coordination Services team consists of licensed nurses and social workers who conduct health and functional assessments, develop health action plans based on the assessment or reassessment results. They monitor EPSDT progress, coordinate services with other providers and community programs. They help resolve concerns about service delivery or providers. They help patients maintain Medicaid benefits and refer patients for emotional and behavioral development or serious mental illness evaluation. The goals of the Health Coordination Services team are to improve access to essential services, such as medical and behavioral health care, social services, affordable care, and preventive health services. They aim to improve coordination of care through the assignment of an HMSA health coordinator. They improve seamless transitions of care across healthcare settings, providers, and health services. They ensure appropriate use of services and to improve health outcomes of the member. In our model of care program, we have put our dual care member at the center of the program. And to support the member, HMSA's Health Coordination Services will conduct a health risk assessment, then translate the results into an individualized care plan for the member, and assemble an interdisciplinary care team. Patients are grouped into one of 3 stratification levels for the model of care: the most vulnerable, somewhat vulnerable, or least vulnerable. Some examples of criteria used when identifying a patient who would be categorized in the most vulnerable population would be those members with 5 or more chronic comorbid conditions, patients with a terminal condition, those with 5 or more emergency department visits within the last 6 months, or conditions such as severe dementia. All determinations are based on the member's health risk assessment as well as clinical judgment. Now we're going to talk a little bit more about the health risk assessment and how it helps to develop the individualized care plan. The health risk assessment is conducted by a member of HMSA's Coordination Services team, or it can be done by the member's PCP. It's initially done within the first 90 days of enrollment, and then we reassess at least annually in case there are any changes or new health events. We use this information to risk stratify the patient into one of the 3 risk levels we talked about. This helps determine the methodology in which we'll communicate with the dual care member. For the most vulnerable patients, we'll communicate in person. A member of our coordination services team will go out to the patient and work with the patient face-to-face. Patients in the somewhat vulnerable category are usually communicated with via telephone, and the least vulnerable patients will receive health tips and information via mail or email. This information is used to formulate the individualized care plan. In the box on the right-hand side of your screen, we describe for you how the care plan is developed. Based on the health risk assessment results, HMSA will use its aerial algorithm and clinical judgment, as well as obtain input from the interdisciplinary care team to develop the individualized care plan. The care plan will be modified as needed. Once completed, we'll communicate to the dual care member, their primary care provider, and members of the interdisciplinary care team. We also share the care plan through care transitions. With input from the HMSA member, we'll establish an interdisciplinary care team as an important element of the model of care. The care team is there to support the dual care member, help with their questions, help with coordination of care. Those are just some examples. The team consists of family members, healthcare providers, and others who can help the member achieve their health and wellness goals. The composition of the team is individualized according to the member's needs and preference. The team meets intermittently to ensure that the care plan is on track and achieving the member's goals. The core team members all support the dual care member. The interdisciplinary care team consists of an HMSA health coordinator, an HMSA medical director, and the member's primary care physician. Examples of other team members that the member may choose to include could be family members or caregivers, other specialists, their dietitian, maybe their pharmacist, gerontologist, or behavioral health specialists. Any additional care team members are determined by the dual care member. A new component of the current Quest integration contract is Hale'ola, Hawaii's specialized health homes pilot concept. This pilot will provide comprehensive care and services to the expanded healthcare needs population, including individuals with a serious mental illness or substance abuse disorder, multiple chronic physical health conditions, or dual diagnoses of chronic conditions with impairments in an activity of daily living. This new program will provide comprehensive, coordinated, and whole person care to individuals with complex conditions that results in improved outcomes and contributes to a more efficient use of healthcare dollars. Hale'ola will be charged with providing all care coordination services to the expanded healthcare needs population. Services include integrated primary care and behavioral health services, care coordination and care planning, and connections to health-related social services. Hale'ola will also emphasize face-to-face interaction in the home and community through community care teams. Health plans, such as HMSA, will be charged with ensuring that quality care is provided through the Hale'ola. Health plans will also be responsible for monitoring and oversight, facilitating partnerships between Hale'ola and community-based partners, and creating a process for assigning expanded healthcare needs individuals to the Hale'ola. HMSA provides various services for our special healthcare needs and expanded healthcare needs populations. For the special healthcare needs member, care coordination services help members manage disease risks, provide integrative intervention-based solutions, improve quality outcomes and satisfaction, as well as manage healthcare costs. Services provided for members with expanded healthcare needs includes assistance with physical and behavioral care integration and care team coordination. Social determinants of health are addressed with the member to support reduction in unnecessary healthcare utilization and costs. Community Integration Services is a state Medicaid benefit that provides supportive housing services to eligible Quest Integration members, including the expanded healthcare needs and LTSS populations. HMSA contracts with community providers that specialize in pre-tenancy and housing transition and stabilization services. These services have been shown to help individuals more effectively navigate the housing system and obtain, as well as maintain, safe and quality housing. Community integration service providers work closely with HMSA and community care services to coordinate access to healthcare and benefits provided by special healthcare needs, expanded healthcare needs, and LTSS and community care services programs. Integrating behavioral health into primary care is an important way to increase access to effective behavioral health treatment while maximizing the capacity of our limited behavioral health workforce. There are many approaches to integration, but the collaborative care model has the most robust evidence base, especially for anxiety and depression. Compared to the usual primary care approach to managing behavioral health needs, in which the provider either refers the patient to a specialist or manages needs on their own, the collaborative care model offers supports for providers and delivers superior clinical outcomes for common, less complex behavioral health conditions. The collaborative care model extends the capability of primary care teams to identify and treat people with common, less complex behavioral conditions like depression and anxiety. It adds 2 new members with behavioral health expertise to the primary care team, and they provide treatment in tandem with the primary care provider. The model also includes other elements, such as a patient registry and validated screening tools designed to standardize care and follow-up. Project ECHO is a revolutionary guided practice model that reduces health disparities in underserved and remote areas of the state, nation, and the world. Led by Hawaii State Rural Health Association, it's an innovative medical education and mentoring model that builds primary care capacity while improving access to specialty healthcare in rural communities. The goal of ECHO Hawaii is to develop a comprehensive, multidisciplinary group of clinical and community experts who are committed to continuously mentoring primary care providers in specialty areas. ECHO Hawaii aims to engage providers from all healthcare areas and disciplines. More information on Project ECHO can be found at the 2 websites listed here. ECHO Hawaii is a replicating partner of Project ECHO, which is the extension for community healthcare outcomes. It's a successful, innovative medical education and mentoring program that builds PCP skills and improves access to and capacity for specialty care. Some of the things ECHO Hawaii does includes increases health workforce capacity, increases access to specialty treatment, decentralizes specialty knowledge, provides no-cost CME to its participants, leverages telehealth technology, incorporates guided case-based learning, and promotes best practice and measures outcomes. Some of the things ECHO Hawaii does not do are provide direct patient care, practice telemedicine. They do not charge providers to participate. They don't promote any commercial products, and they do not bill for medical services. HMSA can provide or arrange for social and support services to members to help members deal with social and economic pressures that can affect their health. These services include language translation services, including interpretation, sign language, large print, audio format or braille, transportation services, and education and assistance services such as helping members understand their health plan, help them living with chronic conditions, and self-care at home. When interpretation services are required, requests for assistance should be submitted in advance of a scheduled appointment. This will allow sufficient time for us to make the necessary arrangements. To request services, please contact us using the information shown here. Okay, next we'll take a look at members' rights and responsibilities. Members' rights and responsibilities are outlined in the Quest Integration Member Handbook, and this can be accessed in the HMSA provider portal, which is hmsa.com. The information is also available for providers in the Quest Integration Provider Handbook. This information is often helpful in the event you are asked by a member to act on their behalf in filing a grievance or appeal. Providers can assist members by acting on their behalf to file grievances and appeals with the member's written consent. Quest Integration members have the right to receive information about their health plan that is easily understood, easy to read and understand, in audio format, translated into Chinese, Korean, Ilocano, or Vietnamese, or orally translated at no charge. HMSA will send requested materials within 7 days of the request or next business day. Members also have the right to oral interpretation, sign language services, and TTY/TDD services at no cost. Members have rights under state law as stated in the Hawaii Revised Statutes 432E, Patients' Bill of Rights and Responsibilities. And members also have rights under the Quest Integration Plan. Members may make suggestions to us about their rights and responsibilities. Quest Integration members have grievance and appeal rights as well. If a member has a grievance, they may follow the process described in the Grievance and Appeals section starting on page 66 of the Quest Integration Member Handbook. Exercising their rights will not affect in a negative way how they are treated by HMSA or our network providers. This is true regardless of race, color, ancestry, sex, including gender identity or expression, sexual orientation, physical or mental disability, creed, age, religion, national origin, cultural or educational background, economic or health status, English proficiency, reading skills, or the source of payment for their care. Quest Integration members have the right to be treated with dignity and respect. This includes the right to treatment that is fair, without prejudice, and given without regard to their culture. Treatment that does not restrain or keep them away from others unless it's medically necessary or for safety. And that treatment shall not be used to control, punish, or retaliate, nor shall it be for convenience only. Quest Integration members have the right to information and the privacy of that information. This includes the right to information about HMSA and its services, information about member rights and responsibilities, information about HMSA's providers. They have the right to keep their medical records private and speak with their doctors privately, request and receive copies of their medical records. Only the member, their authorized representative, or their doctor may get copies of their records without their written approval. This is true unless otherwise allowed by law. They also have the right to request that their medical records be amended or corrected, the right to know what medical services they can get and how to get them, and also the right to know the names and skills of doctors involved in their treatment. Quest Integration members have the right to choose or change their primary care physician. This includes knowing how to do so, They also have the right to know how we make treatment decisions. This includes information about our payment structure, the right to review any bills for services that are not covered. This right is without regard to the payment source. They have the right to know the reason why a service is not covered and the right to voice grievances or appeals about HMSA or the care we provide. Quest Integration members have a right to information about their medical condition, and it should be given in a way that the member can understand. Except for emergency services, the information should include a description of the procedure or treatment, significant risks involved with a procedure or treatment, any alternate course of treatment or non-treatment, any risks involved with an alternate course of treatment or non-treatment, the name of the person who will carry out the services, any medications they take or may need to take, and any care they need after checking out of a hospital. Quest Integration members may request a continuation of benefits when the following conditions are met: during a state administrative hearing when requested, when they have requested an administrative hearing within 10 days from the mail date of the adverse benefit determination, when an appeal or request pertains to ending, suspending, or reducing services that were previously approved, when services were ordered by the authorized provider, and when the original authorization period has not ended. If we continue or reinstate benefit coverage while the appeal or state administrative hearing is pending, we'll do so until one of the following occurs: the member withdraws their appeal or request for a state administrative hearing, or if they didn't request a state administrative hearing and continuation of benefits within the 10 days from the date when the notice of adverse benefit determination was mailed, or the state administrative hearing decision was unfavorable to the member. We previously reviewed the process for provider grievances and appeals. As part of our members' rights and responsibilities, members also have the right to file grievances and appeals. So now we'll take a look at the process for member grievances and appeals. Members have grievance and appeal rights, including the right to a state administrative hearing. The member handbook outlines how to request a hearing, as well as rules on who can represent the member. Members may be represented by an authorized person or a provider with written consent from that member. Certain HMSA staff can also help the member in filing a grievance. During the appeal and hearing process, the member has the right to continue to receive benefits. Those would be subject to recoupment if denials are upheld. Members may submit their grievance or appeal to the Quest Integration Grievance Coordinator. A detailed description of the process is included in the Quest Integration Member Handbook, available at the link at the bottom of your slide. A member grievance may be filed at any time verbally or in writing by the member's authorized representative, or a provider acting on behalf of the member. Quest Integration members may file a grievance if they are unhappy with the quality of care or service provided, the way our HMSA staff treated them, their doctor, or how they were treated by the doctor or the staff, or if they're dissatisfied with the way their rights were not respected. We'll send a grievance determination letter to the member within 30 days of receiving their grievance. If the grievance determination is not favorable, members may request a grievance review within 30 days of that decision. Members will request this through the MedQuest division, not through HMSA. State determination is made within 90 calendar days from the date of request for review. Quest Integration members may file an appeal with us when one of the following actions has occurred: a service they requested was denied or restricted, the authorization for a service was terminated, suspended, or reduced, they were unhappy with healthcare services because they were not timely, there were unreasonable delays, or the grievance or appeal decision was not carried out in the timely manner, or when an appeal may be filed if they don't agree with a payment that was denied or reduced. A Quest integration member may be requested, an appeal may be requested within 30 days of the adverse event. Verbal appeals must be followed up in writing within 5 business days. An appeal may be submitted by the member, their authorized representative, or a provider acting on behalf of the member with written consent. Member appeals should include information about the member, a description of the situation, and why the member disagrees with the decision. Supporting documents should be submitted at the same time. A response will be sent within 30 days of our receiving the appeal. If the member disagrees with the outcome, they may request an administrative hearing. During the appeal and hearing process, the member has the right to continue to receive benefits. Those would be subject to recoupment if denials are upheld. Our final topic today is cultural competency. HMSA encourages our Quest integration staff and participating providers to acknowledge that their attitudes, behaviors, and beliefs are shaped by their environment, and this leads to more culturally competent professionals. HMSA's Quest integration cultural competency approach is based on the following 3 principles. Quest integration members are multicultural with diverse beliefs, values, health practices, and socioeconomic needs. Quest integration members have the right to receive medical services and to be treated with courtesy, consideration, and respect. And the third is HMSA Quest integration staff and participating providers should respect this diversity and realize that biases and preconceptions about public assistance recipients, including those with disabilities, can be barriers to successfully delivering healthcare services. In support of cultural competency, our member communications are written in plain English and also available in locally spoken foreign languages. We do our best to match members with PCPs who are able to communicate with them in their preferred language. Our outreach and care assistance representatives are sensitive to cultural beliefs, and they aim to improve our members' health status. The Quest Integration Provider Handbook has a section on cultural competency, including myths about persons receiving public assistance. We encourage you to look into this section because it does provide some background on member behavior and how to deal with cultural differences. Here we have some common myths about public assistance recipients. One is that they miss appointments and fail to follow doctor's orders because they don't care about their health or their doctor. Some Quest integration patients have valid reasons for appearing non-compliant. Some may be coping with economic hardships, forcing them to focus their efforts at meeting only basic life needs. Others may not seek medical care due to dysfunctional relationships, unresolved behavioral health needs, or a crisis at home. They may feel uneasy discussing these things with their doctor and often may not offer explanations. Another myth is that providers have to make all the healthcare decisions for Quest integration patients. The Quest integration patient is the primary decision maker when it comes to their own medical care, and they should be given full facts about a recommended treatment plan. An individual's economic status or disability does not negate that person's right to make healthcare decisions for themselves. A third myth is patients with disabilities who bring companions to medical appointments are incapable of discussing their health or medical needs, and providers should address their companion. In fact, people with disabilities may have different communication styles and abilities, but can still articulate information about their health and medical status. It's important to address these individuals directly and recognize that a person with developmental delays may be capable of comprehending or explaining their needs. Another myth is that patients from other cultures have superstitions and beliefs that are incomprehensible to Americans. However, we must remember that all cultures have beliefs and customs that seem strange to those in other cultures. Many cultural beliefs have direct or indirect implications for healthcare. And lastly, it's a myth that people don't want to talk about their culture. They just want to be treated like everyone else. Minorities know they're different, and this difference will always stand as a barrier to building true rapport unless culture is mentioned early in the relationship. When a sincere interest in the patient's culture is shown, people will usually be more than happy to talk about their language, food, and even their beliefs. These beliefs could affect health outcomes due to misunderstandings. For example, a patient who feels Western medicine is too strong, they might only take a portion of their prescribed medications. Recognizing cultural differences and beliefs and addressing them can significantly improve health outcomes. Our HMSA staff undergoes an annual cultural competency training to help resolve conflicts and complaints. We also review all complaints and grievances to ensure timely resolution. We don't assume that lack of member input or grievances is an indication that incidents are not occurring. We look for ways to improve cultural competency, and this is done through member communications like the handbook and quarterly bulletins, member surveys, calls from members, as well as calls from providers. Before we end our presentation, I just wanted to take a couple minutes to show you some resources we have available online to assist you. The link you see here will take you to the Quest Integration Plan Library in the Provider Resource Center. Here you'll find our medical policies, behavioral health policies, forms, and claim procedures specific to the Quest Integration Plan. You can also access the Quest Integration Plan Library from the HMSA Provider Resource Center homepage by selecting the drop-down menu that says More and selecting Quest Integration as shown by the red arrow here. We also have a lot more information on our main corporate page at hmsa.com. The Provider Resource Center is at prc.hmsa.com. Here you will find our policies and forms for all lines of business, links to the Quest Integration Plan Library, the monthly HMSA Health Pro News, as well as other communications that are sent to providers. Alerts may also be viewed on the HIN homepage, which can be accessed using the link at the bottom of your screen. Keep in mind, HIN is a secured site that requires a username and password. If you don't already have access to HIN, please contact us so we can get you set up to use this tool. All of the information we covered today is available in the Provider Resource Center. Anyone can access the Resource Center. There is no logon required. There you'll be able to view the Quest Integration section of the provider portal, our Health Pro News, all other communications. We also post notifications in the Provider Resource Center of upcoming webinars, as well as we mail out flyers. If we don't have your email address, we'll send it to you email if we do have your email address. We encourage you to review these resources or at least familiarize yourself with how to locate them, as we do post the most current information to these sites. One last item I'd like to talk about before we close. I'd like to take a moment to ask you to complete the provider attestation form that was emailed to you. MedQuest has required HMSA to provide training for all providers who are participating in the Quest Integration Program. In order for us to accurately account for which providers have received this training, please take a moment to complete the attestation form, and you can email it back to me directly at paula_murray@hmsa.com. If you are viewing this recording in the Provider Resource Center, please download and submit the attestation form. Again, all forms may be emailed directly to me at paula_murray@hmsa.com. This brings us to the end of our presentation. On behalf of HMSA and Quest Integration, thank you for your attendance.